Hi, I'm Erica Duffy, and I'm going to tell you about cardiothoracic surgery and why it's definitely a career that you should consider. Okay, so cardiothoracic surgery, which is also known as cardiac surgery or thoracic surgery, is any surgery that happens in the thoracic region, which is like this region, so it has to deal with the lungs and the heart and any of the organs that fall into that region. Okay, it's interesting because it's challenging and also because it deals with a lot of the quotation mark life-defining organs, like everything basically but your brain that's life defining. So, like your heart and your lungs, which are both important for life. Your heart, for example, pumps blood throughout your entire body, which is essential for spreading oxygen, getting oxygen to your cells. Okay, there's the history. Education required, there's a 4-year undergraduate degree in pre med, which means like also an emphasis on science. In addition to 4-year medical school, and then usually people go to a 5-year general surgery residency, uh, or a 2 to 3-year cardiothoracic surgery residency after your general surgery residency, and or instead of 2 to 3 years, you could do a 6-year integrated cardiothoracic surgery residency. Um, yes, okay. So there are a lot of colleges that offer pre-med, and there's a lot of colleges that do medical school as a graduate school. For undergrad, there's Harvard, UC Berkeley, and University of Washington. Um, Harvard and UC Berkeley, I've heard just from research of doing colleges in general, it's really brutal and competitive and kind of a miserable environment for some if it's not your like if you're not prepared for it, if that makes sense. So for that reason, I would kind of choose University of Washington, but I've also heard that University of Washington has a lot of weed out classes. So in general, getting this degree and even making it to medical school requires a lot of perseverance and strong work ethic and not um, caving in when you think that you're already failing, kind of a thing. For graduate school, there's also a lot of schools that offer medical school. So Johns Hopkins is one of the top, especially for like biomedical engineering, but for medical school specifically, and University of Washington, which means if you go to University of Washington for undergrad, you can also go for graduate school. There's also, I've looked into some, they're called, I think, matriculation programs, where you can get like admitted into your graduate program before you're even an undergraduate, just because it's like a follow through. So like they're like, hey, we'll be training you with our undergrad stuff, so why don't you just stay for graduate school? Okay, classes that are usually required in general for a pre-med undergrad are biology, physics, general chemistry, organic chemistry, biochemistry, English, psychology, math, and then some other prerequisites that are like general undergraduate things. So some schools require that you take philosophy, that kind of stuff. Tuition costs for each college kind of pricey. These are all the undergraduate rates. University of Washington specifically, since we live in Washington, we get in-state tuition, so that would be like 11,000 a year is what they said. The main exam that's required for graduate school is called the MCAT. It's the Medical College Admissions Test. Prerequisites in general. Okay, so prerequisites to become like a surgeon would be preclinical and clinical training, which happens in medical school, and you'd also have to like be able to apply for a specialty in residency training. However, in addition, there are prerequisites to even get into undergraduate school for pre-med. Mostly taking rigorous course loads. If there's AP and IB classes offered, taking those, focusing a lot on the maths and sciences, so like calculus, statistics, AP biology, AP chemistry, AP physics, those kinds of things. Every day, usually, cardiothoracic surgeons are charged with or are in charge of diagnosing, treating diseases, and doing surgery, right? In addition, they should have research skills, stress management. They should also be really good at interpersonal communication because they'll be communicating with their patient, and you don't want to freak out someone that you're going to be doing surgery on. You want to reassure them, right? Other things is that your hours are going to be really irregular and long because it kind of depends on what patient when they come in and what their case is. Location, usually you'd work in a hospital. Sometimes cardiothoracic surgeons would work in a teaching hospital so that you can teach up and rising cardiothoracic surgeons or just general surgeons. And additionally, there are it's a pretty good entry pay level with 388,000 per year for a base salary, which means it's before they add on the other stuff. However, it can range between 122,000 to 650,000 for base salary. It just kind of depends on where you're at. For less than 1 year of experience, you can average $290,000 in like tips, bonuses slash overtime pay, which means it's not your base salary. The best part of the job, undoubtedly, is that you get to work with organs that define life, right? And you get to change people's lives because a lot of the times people that need surgery need it in order to live. And so the fact that you're giving them another chance at life is something that really appeals to me. The worst part of the job would be that surgery has actually been reported as one of the most stressful occupations with high suicide rates. Um, and that would definitely drive some people away because no one really wants to become suicidal, right? Additionally, I would still want this job. Like, I would still consider the job just because of the benefits outweighing the risks. Um, because I think if you're able to establish a good work life balance, which might be difficult in the beginning, after you establish some tenure maybe and some experience under your belt, you might get better at balancing your work life. So, there's that. We're excited, right? And thank you.